everyone for attending, and thanks to Mental Health Foundation for organizing this webinar for a very important issue for the society for now and for the world that everyone is facing, and we can all feel that pain we all are going through. So that's we always do in RMIT. We always acknowledge the traditional owner of the land. So RMIT University acknowledges the people of Waiwarang and Boonwurrung language groups of the Eastern Kulin Nation, on whose unceded lands we conduct the business of the university. And RMIT University respectfully acknowledges their ancestors and elders past and present. RMIT also acknowledges the traditional custodians and their ancestors of the lands and waters across Australia where we conduct our business.
Thank you, Samesh. We're really delighted, RMIT is really delighted to collaborate today with the Mental Health Foundation Australia to support the COVID-19 crisis in the Indian subcontinent. And we are a small working group assisting with resources and support for the COVID-19 crisis in India. And I'm working with Savesh Soni, Debolina Majumdar, and Sarah Spencer at RMIT in this working group, which evolved from a recent urgent meeting about the crisis in India. We are part of a broader initiative named the Mental Health Innovation Network at RMIT. And this is led by Professor Magdalena Plabansky. And overall, the aim of this network is to promote a healthy and creative recovery during and beyond COVID-19. So thank you very much. And back to Elena.
Thank you, Dr. Soni and Dr. Hill. We are thrilled to have worked with RMIT University to deliver this initiative today. I will now introduce you to our presenter for today, Harlin Gandhok. Harlan is a qualified counsellor who has been working with youth for over 5 years in a range of settings. She has experience working with those from refugee, asylum seeker, and trauma backgrounds, those with family and peer issues, those with a range of mental health concerns, and those with high-risk behaviour. Harlan has spent a significant amount of time at Lifeline responding to and supporting crisis callers and those in high level of distress. She has also worked extensively with women and children experiencing family violence and worked in a first responder organisation. Currently, Harlan is working with young people from 12 to 18 years old in an education setting, where a number of students are newly arrived to Australia with high and complex needs. Harlan is also one of our multicultural ambassadors. Over to you, Harlan.
Thank you so much for inviting me, and thank you so much to RMIT and the Mental Health Foundation for allowing us to present on such an important topic. I would just like to acknowledge that we may be talking about some themes that might be quite triggering for some of the attendees in our webinar today. And if at any point this doesn't feel comfortable for you, or you feel the need to step out, you are most welcome to do so. Please just opt out when you need to, and please, I would suggest maybe let one of the RMIT staff members know that you're just taking a little bit of a break. Thank you. The other thing is that we will be doing a bit of a Q&A at the end of the webinar. So if you have any questions, you may put them into the Q&A chat, which Elena will be moderating. We'll try and address these questions at the end of the webinar, as we might address some of them as we go throughout the slides today. And if you could just remain on mute while the presenters are speaking, thank you. So today's webinar is quite complex, and we are talking about a lot of different things. And I think it's important to differentiate a little bit here about what mental health is and what is mental illness. We all have mental health. It's all something that we experience day to day, and it can fluctuate, day to day. It can change over weeks, months, years, and what we feel one day may not be what we feel the next day. Our mental health is a state of well-being. It is, it can be positive, it can be negative, it can be ambivalent, it can be chaotic, it can be really anything, and it can, we have a little spectrum here, which I've got here. Our mental health can go through this spectrum as well. It's not something that is stagnant and will remain at one particular point. Over the course of our lives, we will go through this spectrum, many times, and sometimes we may go through these with big gaps in between them, and sometimes we may experience different changes quite frequently. The thing that is quite important here is that mental health is, I guess, how you think, perceive things around you and how you feel day to day. It drives how you go about your day. It drives how you think. It is forever changing, like I've mentioned, and particularly sort of at one end of the spectrum, you are quite healthy and you can manage changes and situations quite well. And then you might come to a stage where you're coping with a different situation or a change or an event. You may experience difficulties with something going on in your life, and towards the other end, we have illness. So when we're not really able to manage our general mental health, or we're noticing that the things that we do generally aren't having quite the positive effect that they used to, then we can go towards having a mental illness, which is something that can be diagnosed, and it's sort of a period of poor mental health for a long period of time. And so there is quite a difference in what mental health is and what is mental illness. So some of the things that a lot of us might be experiencing or have experienced in the last over a year now is quite common, and a lot of these symptoms here, or I guess effects of COVID, are quite common, and you can have a look through at what is presented there, but they're not unusual to what a lot of people have been feeling. Some of us have been feeling this for extended periods of time. Some of us have felt a multitude of these throughout the day, throughout the course of the year. Things have changed as the COVID situation has changed, and it's very normal and very common for a lot of us to have felt one or more of these things, or still maybe feeling a lot of these things. And it's by no means something to be ashamed of or worried about, because COVID is something that's actually impacted the whole world, and we're all just going through the same experiences, but just in little different ways. There are some more things here that I've listed, which are common things that a lot of people that I've worked with have sort of displayed over this COVID period, we'll call it. And these are things that even adults and young people and, you know, adolescents, all age groups experience. It's not particular to anyone in one age group, I would say. We've experienced a lot of grief and loss, and in particular in India, there's been a lot of grief and a lot of loss. And that doesn't just mean loss of friends and family, for anyone who might have had someone pass away, but loss of social sort of connections. Loss can be loss of freedom, loss of feeling comfortable, loss of feeling safe. So grief and loss isn't something that's only specific to people passing, but it can be, you know, the sense of loss of you know, normal life, and it can really just be anything that you feel as though you were able to have quite comfortably, and you're not able to have that anymore. So I've just listed a few more things here that I think are quite common things that a lot of us feel throughout our time. These may be things that we experience more so now during this COVID period, or it may be things that we experience throughout the day. A lot of these things may surprise some of us. We might not realise that these are, I guess, signs that we're not coping so well, or there's something going on for us, or we might notice this in friends, we might notice this in family members or those around us, your peers in your classes. You might be noticing some of them feeling like this. It's, again, these are all very, very common things that a lot of people will be going through during this time. A lot of helplessness, particularly being perhaps stuck here in Australia, and not being able to, I guess, respond to family or friends or to those you care about overseas, feeling as though you're quite stuck, and not being able to maybe help them or what to do. Perhaps a lot of denial as well, trying to rationalise, I guess, the pandemic, and trying to really accept that it's not happening, or it's not to the extent that it is. That's quite a common thing that a lot of us are fearing. And guilt is something that a lot of people particularly from the migrant community, can sometimes feel in different ways. And I've mentioned survivor guilt there. A lot of the young people I work with who have experienced trauma, and I would say that this COVID pandemic is quite traumatizing, have this sense of guilt of almost like, well, why am I so deserving of safety, and being able to be in Australia and things are relatively okay versus people that may be in other countries and not having the same access to healthcare or safety, and that can really compound in us and come out in a lot of different ways, and that is very, very common and something that perhaps some of you might be feeling as well. These are more physical symptoms, and the reason I've, I guess, separated them from thoughts and sort of emotions that we might be going through is they're more, I guess, more noticeable, not just in ourselves, but in other people. These are things that we might notice more often with other people and say, oh, you're looking quite tired, or you're not eating so much. We might notice it in friends and family members, but also in ourselves. It's really important to take note of these things because sometimes our physical health is a big indicator of our mental health. Physical health and mental health go very much hand in hand, and they contribute to each other positively and both negatively, depending on how we are caring for ourselves. And I think, yeah, it's quite important to realise that sometimes if we're experiencing quite a lot of these here, and they're different to our norm, that's the other important thing, is that these things here need to be different to what is normal for us. So if you generally are not a big eater, and you're starting to notice that you're quite hungry all the time, if you are more of a morning person and not much of a night person, and you see that change quite quickly, and you start to notice something different to you, then that's where I would say it's cause for concern, where it's different from your level of what you feel normal. So like I mentioned, during this uncertain time and during this COVID last couple of years, it's not unusual to feel quite worried, to feel anxious, to feel really overwhelmed. We have a lot of information coming at us all of the time. We have social media, we have friends and family overseas, we have literally the news at our fingertips, and we can find out things very quickly and very easily, and it can be really overwhelming. That coupled with the demands of your university work, your social life, your family life, whatever all the things might be, coming together can really be overwhelming. And it can get to times where you feel as though you're really struggling to cope, and things aren't going so well for you. When things feel persistent, or we're starting to experience a lot of negative mental health, or we feel as though the things that normally bring us joy aren't starting to bring us joy anymore, or we're starting to notice a lot of changes in how we feel and go about a day, that's when it would be a great idea to reach out and access some supports, which we will talk about towards the end. It's also very important to take care of our physical health. Like I mentioned before, these things go hand in hand together. And I think, one of the easiest things to sometimes think of is exam time, where stress levels are quite high. A lot of people will stay at home, just, in their room, kind of trying to study and get all of their work done and trying to complete whatever assessments might be due at the time. The smallest thing is going for a short walk in that time can help us so much in releasing some of that stress that we're having during that time. And it's really important that we do work on both of these things so that they can, work cohesively. So some of the things that we can do when we feel as though things are out of control, which a lot of us may be feeling, is to try and limit sometimes the exposure to the things around us. A lot of the people I work with are constantly reading a lot of COVID information and a lot of COVID updates, which is okay too. But if you feel that by having access to all of that information, or having too much information, is actually adding to your worry or stress about what's going on, try and come up with something that limits how much you're, I guess, being exposed to. So sometimes we might set recommendations like, you know, give yourself maybe 10 minutes in the morning to read the news, and then that's sort of it. We're not going to read COVID news for the rest of the day. We're going to try and avoid constantly checking the Department of Health updates or reading about things happening overseas. The same can be with getting information about what's happening. Sometimes we can get it from a lot of different places, and it might be helpful to you to decide on one place in particular and say, I'm just going to read about the facts from one source, and that's what I'm going to use as my sort of benchmark, because sometimes there can be a lot of conflicting information and it can make us more confused, more worried, and really aid to sort of our stress about what's going on. So it is very tempting to stay informed, and we all want to stay informed, but sometimes the small things like limiting how much we are exposing ourselves to can help us manage how we're feeling about COVID as well. So some of the things that you can do to manage your time while experiencing a whole range of stresses and things. I would say that, you know, self-care is something that a lot of us already do. A lot of us already have things that we do that help us feel good and help us feel positive, and they are things that we must continue to keep doing. Self-care is different for everyone, so what you do may not be the same as what someone else finds helpful, but it's important to try and come up with some things that work for you. I've just listed a couple of things there that some people might like to do. Some people may already be doing these things. It's important that when you do think of things to help yourself, I guess, ease your stress and worries, that sometimes we come up with things that we can do on our own, along with things that we can do with other people. It's really important that we maintain those positive connections with other people around us, and you know, just not sort of limit to kind of keeping to ourselves. It's really important that we do things with other people. Could be joining a support group, could be doing something with your peers, just going for a walk together, making a meal for some friends. It could be really simple things, but just maintaining those strong positive social connections. So some things that might help in maintaining positive mental health and good mental health, I've tried to condense it to as small as it can be, but we could talk about this forever. Very simple is setting up a daily routine. So setting up things that you need to get done for the day. So that could be assessment tasks. It could be going to the library. It could be whatever you know that you need to get done for the day, your errands. But making sure that you do put things in there that are part of your self-care. So you've set aside time for reading, watching movies, seeing your friends, going to the gym, whatever it is that works for you. But really important that we're making a point to try and put something there every day that we feel gives us a good sense of routine and a good sense of, I guess, completing a task. Staying active is really important, and a lot of you will know that, exercising gives us endorphins, and a lot of positive sort of chemicals are released in the brain and really help with our mood. It doesn't have to be a gym. You can go for a walk, you can do yoga, you can do anything that you really like, but really making sure that we're keeping our bodies moving and active. Eating well, so trying to make sure that we are eating nutritious food, we are eating enough throughout the day, and that we're avoiding any alcohol and drug use where we can, and trying to keep the idea of, staying hydrated, just eating well. For some people, keeping a meal plan on the fridge or writing out what they're going to make for each meal throughout the week can be helpful, and a good way to keep some people sort of in check if you feel as though you sometimes struggle to kind of stay on track. And staying connected is of course very important as well. So talking to your friends, your family, FaceTiming, actually seeing them face to face in person where possible as well. Really important that you stay connected throughout the day, and you are making times to nurture those social connections as well. The next thing that we wanted to talk about is trauma and the different types of trauma. It is a big, scary word, and sometimes I think we can always think the worst when we think of the word trauma, and I think a lot of time people associate it with things like war or highly sort of violent situations, but trauma is our response to something, and it's usually an event where it really overwhelms our ability to cope. So this COVID time is actually quite traumatic to quite a lot of people, and it can be for a mix of so many reasons, and it can have a lot of compounding factors, and it's not just one. How we respond to it is going to be different for every person, but trauma is essentially a state of high arousal where we feel that a severe threat or perception of severe threat is overwhelming our capacity to cope. So a lot of us right now are, you could say, traumatized from the lockdowns and from the year that we have had. It's been a year like no other, and a lot of us are constantly on, feeling quite overwhelmed and almost on edge. A lot of people would use that on edge as a descriptor, because we're constantly thinking, are we going to experience another lockdown? And you might be thinking, am I going to hear some more information from overseas? Am I going to hear more about what's happening in India? And is, my family members going to be experiencing a lockdown? What are they going to go through? And so we're going to have this really high state of arousal where we're just constantly thinking about what next and what's going to happen next. What's important also to differentiate is that there are many different types of trauma, but the two that I've listed here, acute trauma, so the result from exposure to a single overwhelming event. So we might experience something like a car accident, or we might be witness to something and we feel quite overwhelmed and struggle to cope or come to terms with what we've experienced there. And then repetitive trauma results from exposure to multiple chronic prolonged traumatic events. So for some of us, it might be that we have a lot of compounding factors in our life. So we may have multiple things happen in our life, and it's ongoing, and we're being exposed to it again and again. It could be also the fact that we are hearing about a lot of negative information, and we might be experiencing a lot of loss in India. We might be having a lot of family members and friends going through the healthcare system. We might be having a lot of family members pass away. So, a lot of that can cause trauma. It doesn't mean that when we are exposed to these situations that we will all experience trauma, but a lot of us will have this response, particularly during this time where things are still quite uncertain and we're not sure what's going to happen and where things are going to go. The other thing to also note is that there can be big traumatic events and smaller sort of traumatic events. It doesn't mean that things are less worthy of than the other. What we experience is really different, and how we respond to it is really different as well. And it doesn't mean that because one person's had something more or less of, that they are any less different. It's still how we have perceived it to be quite traumatic to us, and how meaningful it means to us as well. So some of the things that you might look at for your friends or family or for yourself as well is when to consider supports. When we talk about mental health, like we mentioned, it's positive, it's negative, it's ambivalent, it can be anything. But if we're experiencing a lot of periods of low and we feel as though our mental health is quite negative, we're really struggling to go about our day and things don't seem to get easier for us, that would be a big indicator that it might be time to get some extra support. If you feel as though the things that you are normally able to do on your own, you're not able to sort of find joy in them, or you're really struggling to do them on your own, your self-care isn't maybe being as effective for you as it once used to be. If you feel that things aren't improving, if you feel as though you're really trying to move on and kind of go on about your day in life, and it just doesn't seem to feel better for you, you're feeling quite negative, you're noticing that you're having a lot of negative self-thoughts and negative self-talk. So we might be really going, well, I don't deserve this, I shouldn't do this, I can't do this. You're starting to notice that you're really losing interest in things around you. So maybe you really like playing soccer and that was something you did every Sunday, and that's just not something that really drives you anymore. If you're noticing any changes in your sleep and diet patterns, and you have to remember that this is something different for what is normal to you. Everyone has different diets and different sleep patterns and different levels of sort of energy, but it has to be different from what is normal for you, which will be different for everyone. And of course, if you're beginning to have any negative thoughts that include thoughts of self-harm or suicide, or I guess hurting anyone else around you, it's really important that we do consider supports and reach out so that we can try and manage those as well. But anytime is a good time to reach out for help and reach for support. We don't have to be, I guess, in a constant state of negative or poor mental health to be ready to open up. If you're starting to notice that things just don't feel good for you, or you feel like you're relatively managing okay, but you feel it might be good to just know what's around you, what strategies are around you, and what help is there for you. You know, there's no right or wrong time, and there's no limit on when someone can access help and reach out to get the things that they might need. So why would someone reach out for help, and why would you want to seek professional help? I've just listed a couple of points here that might be helpful to some of you. It could be a very foreign concept, actually reaching out to someone and saying, I need help. Coming from the Indian community, I'm very well versed in a lot of the stigma that comes around reaching out for help and asking for help, and you know, getting linked in with a professional service. But this is something that is quite important and quite helpful to a lot of people, and I would advocate very strongly that we all be aware of why do people reach out for professional help and support. It gives you someone that's non-judgmental, extremely experienced, impartial, and they aren't related to you, and you can talk about anything in confidence to this person. It's really a safe space for you to feel as though you can explore your thoughts, your emotions, and anything that you might be going through. It also gives you the opportunity to help you identify things that may be making the situation more difficult for you or making things worse, but also give you the strategies to work through those and to actually be able to improve that. It will help you sort of challenge your negative behaviours and negative thoughts that you might be having, and give you the skills to really cope and manage with what's going on. Sometimes, you know, those things that we know make us feel good may not work as well, or maybe starting to lose, I guess, their helpfulness, and having someone else to reach out to, or having a support group or someone else can kind of help you feel like you're not alone and give you the skills to kind of manage and build your resilience in coming up with different ways to support yourself or those around you. Other places where you can reach out for help, there's a few places here that we've listed. If you are having any sort of thoughts of harm, please call 000 in the first instance, and not just for yourself. If you are worried about friend or family members' health here in Australia, you can also call Lifeline as well. They're free to call and they are 24/7, so always there will be someone there to support you with what you're going through. And then there's a few other places that we've mentioned here, and Head to Help is actually a Victorian government initiative that has come out of this COVID crisis. They've really noticed that our mental health has really been impacted by the situation, and we need a lot more supports. You don't need a Medicare card or any kind of ID to access Head to Help. They have a number of centres across Australia, and you can read them on their website. And so for those of you who may not have Medicare or things like that, you can still access help and reach out, and there will be supports available to you. Pass on to Dr. Alyssa to talk about these in a bit more detail, or Professor Magdalena. These are more specific to the RMIT students and the student community, and they are in particular, I guess, in response to the crisis that's happening currently in the Indian subcontinent.
Thanks very much, Harlan, for great information. And really, just because we know that some of the people listening are from the RMIT community, we wanted to briefly highlight that there are specific supports for students in the top left here. There are also staff supports, and in the right panel, COVID-specific supports. And these slides will be made available with each of these links. And the following slide is additional general community supports. Thank you. And some of these Harlan has already spoken to, but again, perhaps interesting as well, registration forms for Indian students with student visas that are stranded in India, for example, and others here. Thank you, and I'll just hand back to Harlan.
Thank you so much. We've talked about quite a lot of different things here, and I've really briefly touched on a number of topics. This is something, mental health is something that we could talk about for a long time. I'd like to give you the opportunity to ask any questions that you may have, or any statements that you'd like to make that you think would be helpful to some of our attendees here. We do have a Q&A box in which you can post some questions into, or I guess even into the chat if that's easier for you. And Elena from Mental Health Foundation and myself will do our best to answer those questions for you. So even if you just want to put your mic on and ask those questions, I'm happy for that too. And of course, we've got the phone number here for the mental health helpline, which is available for all of you to contact as well. So if you've got any questions, if you want to know more about, I guess, what supports are around for you, you want to reach out for some friends or families, or you just want some information on how to navigate a couple of, I guess, mental health systems or supports here, you can call the helpline and someone will be able to help you out.
Okay, so the question is, often it's not about you, it's about supporting others around you. And I think, I don't know, but I feel it's really important to emphasize that if you're a carer or somebody that's trying to support somebody else, that may be taking more out of you than you think. And you may reach out before things get bad. And, you know, before things start flaring up, you may want to, but I don't know, is that the right thing to do?
I would definitely agree with you in what you're saying. Being a carer for someone or caring for someone, or whether that's here or overseas, it can put a lot of stress on us and pressure on us, and sometimes we don't realise how much it is impacting us. And absolutely, if we feel that we want to reach out and join some supports, there are a lot of support groups available for people who are carers of people. There are lots of services that can help you to understand what it means as well, you know, and the impact it has on you. And absolutely, I would think it would be great to reach out prior to it reaching a point where we feel as though we're a bit stuck, or we're feeling really heavy with the duty of caring for someone. But yeah, like we said before, there's never a wrong time to reach out for help, and it's always open to anyone.